कहना कि इट इज अ सोल या दिस इज अ सोल भी ठीक नहीं, क्योंकि आत्मा एक चैतन्य सत्ता है, ना कि जड़ पदार्थ। अब तक जाने गए सूक्ष्मतम कण के भेद में आत्मा कितनी छोटी है, आत्मा का आकार क्या है, वो छोटी है या बड़ी? वास्तव में ये प्रश्न ही उचित नहीं है, क्योंकि चेतन सत्ता की तुलना जड़ पदार्थ से नहीं की जा सकती। ये ऐसा प्रश्न है जैसे हवा पहाड़ के भेंट में कितनी बड़ी है। आत्मा सूक्ष्म व पराभौतिक है और कण पदार्थ भौतिक है। मैं आत्मा आकार में अति सूक्ष्म हूं, मैं अविभाज्य हूं। कोई शस्त्र मुझे काट नहीं सकता, अग्नि मुझे जला नहीं सकती, हवा मुझे उड़ा नहीं सकती और पानी मुझे भिगो नहीं सकता। कोई भी भौतिक पदार्थ मुझ आत्मा के पथ को रोक नहीं सकता। मैं आत्मा अविनाशी हूं और मेरा अस्तित्व सनातन है। मैं मस्तिष्क के बीच में भ्रिकुटी के मध्य में स्थित हूं, यहीं पर विराजमान हूं। मैं आत्मा शरीर की सभी इंद्रियों का मस्तिष्क द्वारा संचालन करती हूं। मुझ सूक्ष्म प्रकाश पुंज में ही अनगिनत प्रक्रियाएं चलती हैं। मुझ में ही देव के विभिन्न अंगों के संचालन, मानसिक चिंतन से लेकर अपने भविष्य के भाग्य को निर्धारित करने तक की बातें शामिल हैं। मैं आत्मा स्वतः ही ये जानती हूं कि मेरे शरीर के लिए क्या ठीक है और क्या नहीं, लेकिन मैं ये भूल गई हूं कि उस ज्ञान को किस तरह प्राप्त करूं। जब आत्मा शरीर में स्थित होती है तब वो
म्यूट है।
Good afternoon, sir.
हाँ सर, गुड आफ्टरनून सर, कैसे हैं? हाउ आर यू?
I'm very good, sir.
Right, sir.
First of all, sir, my apologies. I think there was a miscommunication on my part only in communicating about the
भाजी
title.
स्टार्ट कर सकते हैं अभी अपना?
हाँ, yes, we can.
My apologies, sir, for delaying you, sir.
No problem.
All the PCs are connecting, sir.
No problems. No problem.
सभी से रिक्वेस्ट भी है राजीव भाई, अगर सारे अपने वीडियो ऑन कर लें तो अच्छा इंटरेक्शन भी हो सकता है।
Okay.
सभी
Okay. All the PCs are requested to switch on their videos, please. Gentlemen, it is Colonel Rajiv Singh, Centralog ECHS. Kindly switch on your videos. Thank you.
राजीव भाई जी, अभी आप भाई साहब इंट्रोडक्शन दे सकते हैं, स्टार्ट कर सकते हैं।
Good evening, everybody. Today we are lucky to have Dr. Satish Kumar Gupta, a renowned cardiologist among us, who will be telling us about non-communicable disease today, how Rajyoga is going to help us. Dr. Gupta is presently is the Director of Cardiology and Medicine in JWM Global Hospital and Research Center, Mount Abu, Abu Road. He is MBBS from Maulana Azad Medical College, Delhi University. He has done MD in internal medicine from Lady Harding Medical College. Awarded with FCCP Fellowship Award by College of Chest Physician. Again, long-term training programming cardiology in Sir Gangal Ram Hospital and Escorts Heart Institute and Research Center of New Delhi. He is FIAE, a fellowship award. He has received a fellowship award by Indian Academy of Echocardiology. FIMSA fellowship award by International Medical Sciences Academy. And he has headed a research team which has developed a 3D healthcare module, which includes healthy heart, happy mind, and healthy body. Dr. Gupta is a guide of MD, PhD, DNB, international and national faculty in various international and national conferences in India and abroad. With this introduction, because there is a long list of achievements of Dr. Gupta, which though I want to continue with that, but just looking at the time constraint, I'll request Dr. Gupta to kindly enlighten us with your knowledge. Thank you, sir. Over to you, sir.
Am I visible?
Yeah.
Yes, sir, you are
Fine,
visible.
sir.
And the presentation is also visible?
Yeah.
Presentation is visible,
Yeah.
sir?
It is visible.
So, good afternoon, dear colleagues. Today I'll be talking to you effect of Rajyoga meditative lifestyle, on which we have been working for last 28 years. When I was in Delhi at one of the prestigious heart hospitals in Delhi, then I had planned a program with Ministry of Health and DRDO.
गुप्ता भाई साहब, ये कन्नड़ राजू भाई इंग्लिश लैंग्वेज ठीक रहेगा, मिक्स करें भाई साहब?
Should I speak in Hindi or English or mix?
कन्नड़ राजू भाई जी बताएंगे आप? भाई साहब मिक्स कर लेंगे तो ठीक है थोड़ा, क्योंकि स्टाफ भी बैठा है ना, मिक्स कर लीजिए.
No problem. So I'll just mix speak in both and Hindi and English combined. Huh? So, well, in 94-95, I had planned when I was working at one of the prestigious heart hospitals in Delhi. Then we had planned a study in collaboration with DRDO. Dr. APJ Abdul Kalam, he was the then scientific advisor to Raksha Mantri and also the Director General of DRDO. And then we had discussed with the sir, and then the study was planned with three tertiary cardiac institutes in Delhi, Ahmedabad, and Mumbai. And I was talking to you about that study also. And during last more than 27 years, we have been working on heart patients, angiography documented heart patients, which was effort from different heart institutes from different hospitals. And now we have about 11,000 angiography documented patients. And I'll be sharing with you that experience and how this Rajyoga meditative lifestyle has been able to modify the lives of people suffering from heart disease. It has addressed not only heart disease, it has not only opened the heart blocks, coronary blockages, but also ना खाली हार्ट की बीमारी ठीक हुई है, बल्कि साथ साथ उनको ब्लड प्रेशर, डायबिटीज, ओबेसिटी, the dyslipidemia, the fatty liver disease, GERD, IBS, migraine, anxiety, depression, almost each and every disease which they had, skin disease, so like psoriasis, every disease, like we talk about non-communicable disorders. And some of the patients also had CA prostate. Even their prostate, this high PSA levels. they became normal. The tumor also disappeared. Right? Many patients. So I'll be sharing you some of my experiences with you today afternoon. And if any questions, then you can ask me after the talk. So this is the Global Hospital Research Center, which I had joined in April 95. I had my my first meeting with Dr. APJ Abdul Kalam on 9th of March 95. And then we had planned the study. And within a month and about 9 days, a month and 6 days, I left Delhi. I left my heart hospital in Delhi and shifted to Mount Abu to carry out this research. And this is another branch of this hospital in foothills of Mount Abu. We call it Global Hospital Trauma Center. I just to present you, I'll start with heart disease, but in the meantime, I'll also be sharing with you other NCDs. If I just take the prevalence of heart disease, अगर हम heart की बात करें, तो 1960 में about 1% people were suffering from coronary artery disease in the country, and the disease used to come in 60s or 70s. तब बीमारी 60-70 साल की उम्र में आती थी. किंतु इस पिछले 1970 से अगर फिगर्स को देखें तो हार्ट की बीमारी तेजी से बढ़ी है, स्पेशली वर्किंग यंग पॉपुलेशन. अगर हम बात करें 2015 की, जो 2015 में सर्वे हुआ, एट दैट टाइम उस समय 62 मिलियन लोगों को हार्ट की प्रॉब्लम थी, अबाउट डॉक्यूमेंटेड केसेस ऑफ CAD. बट यू नो दैट फॉर एवरी हार्ट पेशेंट there are 102 patients at least, because heart disease doesn't tell us in advance. That's the coronary event doesn't tell us in advance. So, and at that time, 2015, less than 50 years age group had more than 37. That is 37 million people were below the age of 50 years. That what does it mean? It means that the more than 60% patients were below the age of 50 years. And that year, 2.9 million people had died because of CAD or stroke, and out of which 1.5 million were below the age of 50 years. You can imagine that this is no more a disease of old people. ये old senior citizens की बीमारी नहीं है. Now this is a disease of young people, or you can say working young population, which is being hit the hardest. Now I'll just show you some of the case studies. Now here is a patient who is 48 years old. He's from Haryana, Rohtak. He's a known hypertensive, known diabetic, known smoker. He's a sedentary lifestyle person. He's a little obese also. He had one intervention done in the LED because he had a coronary event, and then he had to undergo angioplasty, a stent in the LED with the drug-eluting stent. After 3 years, he again had 2.5 years. Again, he had a heart problem. Again, it was found that LED, there was instant stenosis, and a new block had come in the OM1. Then he had to undergo angioplasty for two blocks, right? OM1 and LED. I hope I'm clear. Yes?
Sir, everybody is on mute, sir. So they all are listening.
Okay, no problem. But I hope I'm clear.
They can write chat.
Dr. Rajiv.
They can write on chat ना, chat पे लिख सकते हैं.
Okay.
Chat, you can convey your acknowledgement through chat. Thank you.
No, I'm just saying, yeah. I'm just asking. Okay, my speed is normal. I'm not fast, and you're listening, right? Okay, if there is some problem, you can immediately tell me. Okay, no problem. No problem. And then almost 3.5 years later, again the symptoms came back. Then he had to undergo bypass surgery in one of the premier heart institutes in Delhi, and bypass was done in Feb 2014. And after that, after 3 months, he started having symptoms. TMT became positive, strongly positive, and then he went to Houston, US, where he had undergone, जहाँ पे उनकी angiography दोबारा हुई, and they found that all the grafts have got blocked. And then it was balloon angioplasty to the grafts was done, Lima to LED, another RSVG venous grafts were also, angioplasty was done. But after 4 months, again, he started having problems. I'll just show you. You can see this, all the grafts, they got blocked. This graft got blocked. This graft got lima to LED graft got blocked. This is also blocked. And the previous stent side also, the restent restent stenosis, right? Instant restenosis. You can see this. So what I mean to say is that the interventions do not solve the problem. They are palliative in nature. They do not treat the root cause, right? Like another patient I will share with you. This is another patient from a different city in Haryana. He is 47-year-old. He's not an obese person. He is not hypertensive. He is not diabetic. He is not a smoker. He daily has exercise. He's a vegetarian, and he's lean and thin person. He had coronary event in 2013. He underwent angioplasty intervention to RCA. 2014, again instant restenosis, and LCX was diseased. So again, two stents were put. Again, but it could not relieve him. 2015, he had a bypass surgery. And after 2 months of the bypass surgery, again he had symptoms. So this is what happens. And then another problem in Indians is Indians have got diffuse disease, which is not operable. Like this person, like in Indians, if there are 100 patients with coronary artery disease, 54% Indians will have diffuse disease, not operable. No intervention can be done. Neither angioplasty can be done or bypass can be done. You can take one of the examples like this. See this. The LED has got proximal mid distal block disease. D1 also has disease. The PD also has disease. You can see this. And RCA also has disease, which is not operable. Similarly, we have so many other patients. Now, this lady from Delhi, she had 16, till now she had 16 stents and one bypass surgery. And still she was not able to walk, about 50 meters even. And then she came to us, and now she is in a good health, and she is able to walk 4-5 kilometers daily, and without, TMT is also negative. And see this, the other patient, he had 7 stents to put, but still he was not able to walk properly, like this. So basically, the state of our modern heart care or modern healthcare, what we do is we do interventions. हम angioplasty करते हैं, blood eluting stents use करते हैं, bare metal stents use करते हैं, bypass करते हैं, and statins use करते हैं. Different trials like Courage trial, OAT trial, Master trial, Inter-Heart study, they all have shown that whatever we are doing is essentially palliative. It does not address the root cause. The root cause is genes, genetic factors, mental stress. Different studies have come that how type A behavior, anxiety, anger, especially the cynical type of behavior, hostile type of behavior, that means revengeful type of behavior, finding fault with others, not able to share your stress, loss of emotional support, loss of psychological support, and this type of the depression, they lead to long-term endothelial dysfunction, thereby causing the disease. People who have got psychological stress, psychosocial risk factors like this, type A behavior, anxiety, anger, depression, or not able to share, isolation, then these people have high prevalence of heart disease. And all these factors multiply because they're in the mind, or in the mind. So it's a mental stress, a very big factor. And the root cause, the diet, wrong diet is another important. Fast and junk food, exercise or no wrong exercise or no exercise. Some people go to gym, and especially in the night, and they exercise, which is wrong. This should be moderate aerobic exercise, not in the anaerobic atmosphere of a gym. Sleep, wrong sleep, going to bed late, getting up late, and tobacco in any form. They are the real culprits. And what we are doing is our treatment is only one dimensional. We address only the body. While we know coronary artery disease is a psychosomatic disease. Heart disease is a psychosomatic disease. First it comes in the mind and then comes to the body. And it's a lifestyle disease. So we have to modify that. Another patient, this is a patient from US, Texas, and he has got diffused in all the three arteries. Non-operable, it's a multifocal disease, diffuse disease, not operable. So when he came here, and then now he's okay for last 7 years. Now, so basically, these different studies have told us that when the interventions are done, stents are put in, drug-eluting stents or bare metal stents, they do not prolong life or even prevent heart attacks in stable patients. And bypass surgery, post bypass surgery, these studies have been carried out. At 5 years follow-up, it was seen that it prolongs life in less than 3% of patients. But when you followed the disease, these patients for 10 years, this was not observed. This benefit was not observed. So changing lifestyle, but on the other hand, changing lifestyle prevents or reverses not just heart disease, but also many chronic diseases of mind and body. Almost every disease of mind and body. Whenever you're changing lifestyle, that addresses each and every cell of the body, and also our thought process, emotions and thoughts, attitudes and memories as well. Now, like I'll just take you one example. Figures of in 2006 issued by American Heart Association. Every year they about 2 million people develop heart attacks, coronary events there in the US. And out of which every year they do 1.3 million angioplasties preventions. And which cost them up 60 billion people, $60 billion, and about 4.5 lakh bypass surgeries, which is cost about 44 billion. This is 2006 figures. And if I tell you the 2023 figures, they spent about $150 billion every year on these two procedures. And still, the results, it prolongs life, but now we have a lot of people with heart failure, low ejection fraction. They need now more heart transplants because of the ejection fraction has gone below 10%, 15%, 20%. So they go for more heart. And there was a study which is published in 2009, in which it was seen that if you practice meditation, you take proper diet, a balanced diet. The very important thing is it should be balanced diet. It should not be only say carbs are there for just devoid of carbs or protein diet or high fat diet. No, it should be balanced. Everything should be balanced. That means the carbohydrates, the proteins, the fats, and the water, the vitamins and minerals should be in adequate amount. And then it can change gene expression in hundreds of genes in only a few months. तो अगर हम प्रॉपर मेडिटेशन करते हैं, प्रॉपर वेजिटेरियन डाइट, प्रॉपर डाइट खाते हैं, बैलेंस डाइट खाते हैं, और प्रॉपर लाइफस्टाइल मींस बेसिकली following your biological clock. There's a biological clock in the hypothalamus in which there's time to go to bed, time to get up, time for meditation, time for planning, time for breakfast, time for lunch, time for dinner, and time for working. The best time for working. So if you follow that clock, then you can change gene expression in hundreds of genes in only 3 months, what they've seen. And genes associated with CAD, coronary artery disease, cancer, obesity, hypertension, diabetes, and inflammation like inflammatory autoimmune diseases or inflammatory bowel disease. And all these they were down regulated or turned off. So gene ही turn off कर सकते हैं. And whereas protective genes can be upregulated or turned on. So by even genes can be changed. Gene expression can be changed by practicing meditation and proper diet and proper lifestyle modification. So I'll just be showing, sharing with you the results of this trial, which we have done over last 27 years. Initially, the study was published in 2011, and this was the trial, a study which was in collaboration with DRDO. We started in Feb 98. The stress management, Rajyoga meditation, moderate aerobic exercise, and low-fat, high-fiber diet. And where 3 tertiary cardiac institutes, one was in Mumbai, Grant Medical College and JJ Group of Hospitals, and then BJ Medical College, Ahmedabad, and UN Mehta Institute of Cardiology, Ahmedabad, and then Mamazar Medical College, my mentor college, and Jeev Pant Hospital from Delhi. And it was sponsored by Ministry of Health. And Dr. Abdul Kalam, His Excellency, was he was looking after the study very well. He used to come to the Mount Abu, and he used to meet patients. He came 5 times to meet the patients and talk to them, and talk to almost every patient. He used to see the results for himself. And then we had for different interventions, we had different coordinators and researchers. So this research project was started in Feb 95, had a vision in the morning after meditation, clairvoyance. March, April 95, talk in IMA meeting, collaboration with DRDO. Appropriate project submitted to Ministry of Health and Family Welfare. And CAD project started in Feb 98. This study we published in 2011 and with the name of Mount Abu Open Heart Trial, and in September 2011. And in 2013, we were informed by the BioMedLib, one of the bodies who assesses the different studies all over the world. And they told us in July 2013 that this study is in the field of cardiology. In the studies, it comes under in the list of top 20 articles, research articles all over the world. And your study is number one. That is, most of this study has been researched at the visited by maximum people, researchers and doctors all across the world. So this study became number one in top 20 studies in July 2013. And then every 3 months we were informed the study remains number one and remained number one till November 2015. That is almost 2 years and 4 months. It remained number one all over the country, all over the world. And then in 2017, American Heart Association has issued a scientific statement on meditation and cardiovascular risk reduction. And in this study, they showed that this study, the Mount Abu Open Heart Trial, is a trial where this Rajyoga meditative lifestyle, we call it 3-dimensional Rajyoga meditative lifestyle, because it addresses each and every aspect of human being, that is spiritual aspect, the mental aspect, and the physical aspect. All the 3 aspects of human being are addressed. And in this study, they said that this study is not able to address only the heart disease, but also addresses almost all the risk factors of heart disease, coronary heart disease. But they said that this study should involve more people. We should conduct the study in a big way. And we have till now, at that time only 508 patients were there in the study. Now we have about 10,976 patients, angiography documented patients in the study. This is the largest trial. Till now, we have 27 years of CAD project program completed in Feb 2025. And for this, we are coming up with a Global Institute of Heart Health and Lifestyle Sciences, Arogyam, Academy for Healthy and Happy World. And the foundation stone was laid by our Honorable Prime Minister of the country, Shri Narendra Modi ji. And soon we'll have that institute ready, maybe within a year or so. So basically, to coming up for the cause, the all NCDs for that matter. Mind has got 4 aspects. We call it team for thoughts. Mind has 4 aspects. First aspect of mind is thoughts. Second is emotions. Third is attitudes. And fourth is memories. Right. So whenever we have negative theme in the hypothalamus, every thought or emotion is converted into a protein molecule, which is called as a neuropeptide. And these neuropeptides, which are formed in the hypothalamus, for every thought or for every emotion, there's one neuropeptide is synthesized in the hypothalamus, and through the blood, it reaches the cells, and cells have receptors for each of these neuropeptides. And there's these receptors, the neuropeptides, they go and lock on the receptors on the cells, and then the cells reacts accordingly, right? And then there's the release of stress hormones, and our sympathetic system becomes overactive. I'll be showing you the results of the study. मैं आपसे शेयर करने वाला हूँ कैसे हमारे स्ट्रेस हार्मोन्स बढ़ते हैं, कैसे हमारी सिंपैथेटिक एक्टिविटी बढ़ती है जब भी हम कुछ भी नेगेटिव हमारे थॉट्स या नेगेटिव इमोशंस, नेगेटिव एटीट्यूड्स होते हैं, और इससे हमारे अंदर फाइट एंड फ्लाइट रिस्पॉन्स आती है, फीलिंग ऑफ डिसईज आती है, सैडनेस होती है और लैक ऑफ एनर्जी, वी फील लैक ऑफ एनर्जी. और ये जो हमारे एक हैबिट बन जाती है, हमारा एक संस्कार बन जाता है, हैबिट बन जाती है, नेगेटिव थॉट्स के, नेगेटिव इमोशंस के। जैसे नेगेटिव इमोशंस, एक एंगर भी एक नेगेटिव इमोशन है, नेगेटिव सोचना भी एक नेगेटिव इमोशन। एटीट्यूड, शॉर्ट टेम्पर्ड एटीट्यूड और एंजाइटी वाला एटीट्यूड, ये डिफरेंट हमारे। और ऐसी मेमोरीज, प्रीवियस मेमोरीज और पास्ट, हमारे साथ जो भी कुछ हुआ होता है उसकी पास्ट मेमोरीज होती हैं, तो हमारी हैबिट्स बन जाती हैं। दे कीप ऑन हार्मिंग, लाइक दीज आर आवर 8 ऑर्गन सिस्टम्स इन द बॉडी, एंड 8 ऑर्गन सिस्टम्स में जो भी हमारे सिस्टम्स, जो भी हमारे डिफरेंट सिस्टम्स हैं, उसको उसका इफेक्ट होता है। अगर आपका टारगेट ऑर्गन आपका हार्ट है, तो आपके हार्ट पे ये सभी जो नेगेटिव, जो हमारा सिंपैथेटिक ओवर एक्टिविटी और स्ट्रेस हार्मोन्स लाइक एपिनेफ्रिन, नॉरएपिनेफ्रिन और कॉर्टिसोल, जो भी हमारे हार्मोन, स्ट्रेस हार्मोन, जो हार्मोन्स निकलते हैं, उस पे उसका डायरेक्ट डैमेज होता है ना। अगर तो हमारा एलडीएल बैड कोलेस्ट्रॉल बढ़ जाता है, एचडीएल बढ़ जाता है, गुड कोलेस्ट्रॉल कम हो जाता है, हमारी कोरोनरी स्पैज़म्स होने लगते हैं, थ्रोम्बस फॉर्मेशन हो जाता है, हाइपरटेंशन, ब्लड प्रेशर बढ़ता है, एंड कोरोनरी एथेरोस्क्लेरोसिस बढ़ता है, तेजी से बढ़ता है। सिमिलरली वी लंग्स आर देयर, देन वी हैव ब्रोंकियल अस्थमा। Similarly, if your immune system is target organ, then we have recurrent infections. We can have autoimmune disease like rheumatoid arthritis. We can develop cancers. Cancer again is the immune system has a lot to play in creation of cancers. Similarly, the digestive system is our target organ. Then we'll have ulcers, the gastric ulcers or the duodenal ulcers. अच्छा, ओके, आ गए कर दी। हाँ, क्या दिक्कत, कनेक्ट हो गया, इंटरनेट कनेक्ट। हाँ जी, am I visible? दीपक को विजिबल है?
जी वैसा आवाज भी आ रही है, विजिबल भी है, प्लीज।
जस्ट अ मिनट,
ऐसा आप बोलिए, आपकी आवाज आ रही है,
लाइट
ठीक
हमारे
आवाज
चली गई थी। ओके, नो प्रॉब्लम। तो देखिए, तो व्हाटएवर इज अवर टारगेट ऑर्गन, द लाइट हैज कम। तो हमारे जो भी टारगेट ऑर्गन होता है, जो भी हमारी टीम होती है, so we keep on damaging that system, right? On the other hand, if we positive team, then what will happen? The cells of the brain and human body, they release endorphins and caffeines and happy hormones like serotonin. And we also will have relaxation system on, parasympathetic activity, increase in parasympathetic activity. So we'll have feeling of well-being, happiness, health, and pooling of energy. And that is how, with positive team, which we can have through meditation. We learn Rajyoga meditation, which is not only meditation, which is also diet, which also include diet, which also include exercise, which also includes sleep, proper sleep, and which also includes de-addiction. So basically, Rajyoga meditation, 3D healthcare, Rajyoga meditative lifestyle is itself a module which includes everything. And if we start learning, we learn that Rajyoga meditative lifestyle, which leads to a positive team. हमारे सकारात्मक चिंतन की हमें आदत पड़ जाती है, सकारात्मक हमारे विचार, सबके प्रति शुभकामना, our attitude becomes positive towards life and towards challenges in life and towards all the problems in life, and then memories also become positive. तो उससे क्या होता है, हमारे जो एक इम्पैक्ट पड़ता है, जो भी डिजीज है, हमारे चाहे कोरोनरी आर्टरी डिजीज है, चाहे हाइपरटेंशन है, या हमें डायबिटीज है, या हमें थायराइड हाइपोथायराइडिज्म है, या हमारा बाउल सिंड्रोम है, या जीआरडी है, या हमारा कॉन्स्टिपेशन है, या अल्सरेटिव कोलाइटिस है, या हमें कोई भी हमारे जॉइंट प्रॉब्लम, हमारे ऑस्टियोपोरोसिस है, या कोई भी हमें बोन एंड जॉइंट प्रॉब्लम डिजीज होती है, या हमें कोई भी हमारी डिजीज है rheumatoid arthritis है, SLE है, cancers हैं, different type of cancers हैं, asthma है, या हमारी even psychological problems होती हैं, तो उन सबको हम address कर सकते हैं. We can reverse these diseases, and this is what we have seen over the last 27 years. And we have been able to document each and every disease with this. And this is how I just shown that this is how our two right and left brain. This is hypothalamus, and this is about pituitary, and then this is the lower brain, the midbrain, pons and medulla, and this is about the higher brain. We have got power of Asia. Asia means as human beings, we should be first before any action. We should use Asia. Asia means A for analysis. That means IQ, our IQ, our power of analysis, and then synthesis means emotional intelligence. We should be able to apply it. We should be before taking any decision. We should be considering our people with whom we are emotionally connected, to our family persons, and to also people whom we are working in our sort of any place, any working place for that matter, in our hospitals or wherever we are. We are connected emotionally with our colleagues also, and to our family members as well. And then comes international integration. That is, which means social intelligence or spiritual intelligence. That means our whatever action we do is it affects our society and even at large the whole world. And last thing is assimilation. That is, we call it happiness quotient. So before taking any decision, we should consider all these four different types of our intelligence quotient, emotional intelligence, social or spiritual intelligence, and also happiness quotient. And then only we should take action. So because we are higher beings, we should be able to apply that. And the lower brain in animals, they have lower brain is dominant. They don't have higher brain. They don't have intellect, and that's why they have reactions. And these five vices are nothing but reactions: lust, anger, greed, attachment, and ego. Because lust is also because of fear, insecurity. Anger is also because insecurity. Greed is also because of insecurity. Attachment is also because of insecurity. And ego is also because of insecurity or fear. And in turn, I'll be sharing later on how these negative mental tendencies like laziness, carelessness, cynical behavior, that means finding fault with others, hostility. Anger leads to cynical behavior, hostile behavior. And lust leads to laziness and careless behavior. Greed leads to suspicious and assuming behavior because schizoid nature, which ultimately leads to schizophrenia. Attachment leads to anxiety and fear, and ego leads to type A behavior and jealousy, irsha dvesh. So just to sort of recapitulate our knowledge, little bit knowledge of about how artery disease develops. You can see these are our coronary arteries, left coronary artery, right coronary artery, and that divides into LMC divides into LAD and LCX, which supplies the back of the heart. LAD supplies the front portion of the heart and the septum of the heart, and the right coronary artery supplies the right side of the heart. But you can see there are collaterals, intracoronary collaterals and intercoronary collaterals. The normal artery looks like this, and when the artery gets blocked, the cholesterol deposits in the wall, intima of the blood vessel. Then you can see how little blood is flowing through the arteries, and then that leads to problem. And you see, in the childhood, our arteries are elastic. हमारी arteries बचपन में elastic होती हैं. Normally, heart needs 250 ml blood per minute. हमारे heart को लगभग 1 मिनट में 250 ml blood चाहिए होता है. But in times of demand, when we are running or when we are lifting something, because arteries are elastic, तो हमारी supply 6 गुना बढ़ सकती है. That means हम 1500 ml blood per minute supply कर सकते हैं heart muscle को. Whenever there is physical stress or mental stress. There's physical stress when you're lifting weight, climbing stairs, or climbing a hill. And mental stress when there is anxiety, anger, depression, whatever the demands, mental stress comes in, then we can, in those cases, our supply can increase by 6 times, right? Maximum. But when we are normal artery, like in adults, there are arteries when we have stress, type A behavior, anxiety, anger, depression, all those things, and hypertension, diabetes, smoke. These are conventional risk factors, and we have smoking and obesity, etc. Then our 5 years, especially after 10 years, the collection of fats, initially fat streaks, and the plaque keeps on building up. When the plaque becomes about 70%. जब ब्लॉक हमारा 70% के आसपास हो जाता है और arteries plastic, they become, instead of elastic, they become like plastic. Then they do not respond to stress, physical or mental stress. When we're climbing stairs or climbing a hill or when lifting weight, or there's a mental stress, anxiety, anger, depression, whatever these the more demand on the mind, then these coronary arteries do not respond to this stress, and that is how we develop angina. So जब भी हमारी आर्टरी 70% के आसपास बंद होती है तो हमारा स्ट्रेस टेस्ट TMT पॉजिटिव हो जाता है, हमारा स्ट्रेस इको पॉजिटिव हो जाता है, and that is how we develop angina. And when there is a this 70% block is not necessary, even 30% block, 40% block, 50% block, they are more vulnerable. It has been seen more than 60% of heart attacks, the myocardial infarction, happens in territories which are less than 50% block. And these plaques are unstable. हमारे plaque unstable होते हैं. So there is a more load of cholesterol in the plaque. So the plaques are unstable. The cap, the atherosclerosis cap is a fibrous cap is vulnerable, and that cracks. And then once a crack होती है, especially shoulder of the plaque, and there's a sudden thrombus formation, which leads to heart attack. So sudden 100% blockage leads to heart attack. So like fear, anger, anxiety, depression, like they play a great role in causing a coronary event. So अगर हम देखें normal young age, our arteries are normal, and then as we grow with age, stress and other factors, genes, mental stress, and our diet, wrong exercise, wrong sleeping patterns, and addictions to smoking and other things, the plaques initially comes as a fat streak, keeps on building over the years from the age of 10 years, and then keeps on building, and then our arteries get blocked. When 70% plaque happens, or there's a rupture in the plaque, there's a thrombus formation, and then the patient comes to the hospital, and then we diagnose by angiogram there's 70%, 80%, 90%, 100% block. We put in a catheter through radial artery or femoral artery, and then we put in that catheter. On the top of it, there's a stent, and we inflate the balloon, and then we leave the stent inside. And this is how an intervention is done, angioplasty is done. You can see, but even these stents will block. Even stents block. It is much more than what's mentioned. The studies that it's less than 5%, but in real practice, we have seen it is more than 10%. And with the drug-eluting stents also, and depends on the person's psychological social factors, risk factors. Stent also blocks, and then we have bypass surgeries. In bypass surgery, we do not address the root cause, and again we just bypass the block in the LAD or RCA or left circumflex artery, and we just put a lima or lima graft, or we use the radial artery, or हम क्या करते हैं तो हाथ से आर्टरी ले लेते हैं, रेडियल आर्टरी, या फिर हम venous grafts ले लेते हैं, and we just bypass the graft. But like every year we trim the trees before the rainy season, and then in the rainy season again it comes back. So whatever we're doing is just a palliation. It's just like cutting a tree from above, and it does not address the root cause of the disease. So again the restenosis happens, the grafts also block, and then we require redo bypass surgery or repeat angioplasty. So it does not address the root cause. It does not treat the root cause. That is why we require. I told you, I showed you some cases also. This is how it happens. So this study, multidisciplinary research project, was started in PAM 98. Cardiologist, endocrinologist, clinicians, nutritionists, fitness experts, psychologists, and physiologists. We have been working for the last 27 years on this unique user-friendly healthy lifestyle program. We call it three-dimensional Rajyoga meditative lifestyle program. Which is Rajyoga meditative meditation is the core of the program. That means it's a change of consciousness from outer self-conscious to soul conscious. I'll come on to that aspect on moderate to severe CAD patients, right? And we have studied that how the patients can be managed. So we published our Mount of Open Heart trial, and this is Abu Healthy Heart trial, which is a randomized controlled trial. We started in April 2000, and we in which we had two groups: healthy lifestyle group which included stress management through Rajyoga meditation, low fat, high fiber vegetarian diet, and moderate aerobic exercise in the form of walking and stretching exercises and usual medical care. While the control group had low fat, high fiber vegetarian diet, moderate aerobic exercise, and usual medical care. We had published this Mount Abu open heart trial with a follow-up of about 8 years. And this study, Abu Healthy Heart trial, now we have a follow-up of about 18 years follow-up. And we have sent this study for publication, and this under publication. It's being peer reviewed by from that journal. And so in this study, we had two groups, healthy lifestyle group and control group, where everything was same. It formed consent, clinical, CD evolution, psychological analysis was done, because we were also protecting DIPR, Defense Institute of Psychological Research, and Defense Institute of Physiology and Radiology Sciences in Delhi. And we did their lipid profile, the biochemistry, lipid profile, HbA1c, blood sugars, fasting, postprandial, and physiological and hormonal profile also. We also did the EEG, heart rate variability, and epinephrine levels, norepinephrine levels, cortisol levels, dopamine levels, melatonin levels, serotonin levels, endorphin levels, and the serum lipoprotein A levels was also done, and melatonin was done in the saliva. And our DRDO scientists coming from Delhi, they did all these sort of endocrinological, physiological parameters. They almost in every group, we used to have seven to eight scientists coming from DRDO conduct this physiology and endocrinological profile of these patients on day 1 and day 7. So in these patients are invited with the spouse. If the husband is suffering from the heart disease, then wife has to come, and then if wife is suffering from heart disease, then the husband has to come. And it was information education counseling program, and in which all the patients, all the components of healthy lifestyle were taught over next 7 days. And similarly, the control group also the same thing was done. You can see this medication remained as per the disease. People had diabetes, 30% people had diabetes, about 40% people also had hypertension, and about 50% people had dyslipidemia, and about 30% patients had obesity, overweight or obesity. And the diet schedule was same in both the groups. Exercise schedule was also the same, but only difference was in the healthy lifestyle group, we had given stress management through Rajyoga meditation in a structured way. Now all different types of anger, anxiety, and everything was in which they told them how to manage it through Rajyoga meditation. And in this group, control group, they were told to do whatever they are doing. They do it more like prayer, or many patients were also Muslims. I told them to carry out their namaz very sincerely, and but don't get angry, avoid anxiety, avoid fear, avoid cynical behavior, avoid hostile behavior, and daily share whatever stress with the relatives or with whatever, your good friends. And then they were on daily basis, they were supposed to get up a program attendance chart on a scale of 0 to 10. And then follow was done at every individual center. We had sort of coordinators at every level, every block level, and also a cardiologist was appointed in different cities of the country where the study was being carried out. And because we are collaborating the cardiac centers in different three cities, Delhi, Ahmedabad, and Mumbai. And then TMT and ECHO was done every 6 months, and follow-up was done every 6 months at our hospital. These patients again came back to us for after 6 months with the spouse, and then repeat angiogram was done after about 12 months. And this our most of the 80% से अधिक patients, they had either DVD, double vessel disease, or triple vessel disease. Only 20 or less than 20% patients हमारे single vessel disease के patients थे. You can see here. All the data was analyzed initially by us, our statistician, and then at ICMR, DRDO also had appointed one statistician, to analyze the results. Every results were analyzed independently, and so there's no bias, right? And then angiogram reels were also CDs were also coded, and to blind the group allocation or angiographies. So the angiographies are pre or post, and a panel of 2 independent angiographers from CSI, Cardiological Society of India. At that time, the president of CSI, Cardiological Society of India, was himself one of the referees in this study who analyzed our angiograms, and one from Jaslok Hospital and one from Bombay Hospital and the Mumbai. They analyzed our angiograms. And in the clinical status, you see this HLS, the healthy lifestyle group and control group. See this, patients who were not able to walk even 100 meters, they started walking 3 kilometers, 4 kilometers on days 5 or 6. And there were a number of nitrate tablets required. It became less than about 1 or 1.4 at 7 days. Right? And the average exercise duration increased by almost 500%, more than 500%. And average ejection fraction, heart ejection fraction also increased about 10%. So that you can see that this is in clinical status improved within, in some cases it is 7 days or something, even 3 months, 6 months also. And lipid profile also. Those were not the days of statins. Statins were being used, but it was not a rule. Today it is a rule all over the world. So the patients' total cholesterol came down by 24%. The LDL, the bad cholesterol, decreased by 31%. Good cholesterol increased by 16%. You must be, हम जानते हैं कि हम whenever we use statins, they decrease not only LDL but also HDL. But this lifestyle program, it increases our good cholesterol, decreases our LDL, and triglycerides also came down by 31%. Our LDL HDL ratio came down by 37%. So here is an intervention जिससे हम गुड कोलेस्ट्रॉल बढ़ा सकते हैं और अपना LDL घटा सकते हैं, ट्राइग्लिसराइड घटा सकते हैं. और ये तो 7 दिन में ही सिग्निफिकेंटली हमने देखा. We do on day 1 baseline lipid profile and day 7, and a significant 10 to 15% reduction in LDL, triglyceride. Triglyceride reduction was much more, 30 to 40% was seen, and HDL also improved by about 5 to 6% within a period of 7 days. And about 93% patients would open their blocks. We had 464 lesions in our study, and 50% lesions which we had not included in our study, which were 100% calcified blocks. And to our surprise, 29 blocks were calcified blocks also opened up. I'll show you some of them, how it has happened. You can see here, this is a pre-intervention angiogram. This is on the right coronary artery. There is 80% block here near the crux, and this is almost significant block. The repeat angiogram. So it is a very long diffuse disease starting from the proximal to almost to the distal block. It's about 99% at various places. But after 1 year repeat angiogram, you can see this is a significant increase in the diameter, decrease in the disease, right? Can you appreciate this? See, this is 100% calcified block. This is Lilavati Jain from Mumbai. Calcified block here, and there's hardly any flow distal to this. And after 1 year repeat angiogram, you can see this, even this block has opened up. You can see the flow has started, right? In the right coronary artery. Again, 100% block here, and the blood flow has started. Another multiple coronary blocks here in different arteries, they all have opened. There is an 80 and 90% block here, and see this both have relatively open now. And now this patient had 2 coronary, in this patient को 2 बार हार्ट अटैक आया. एक बार एंटीरियर वॉल एमआई हुआ, दूसरी बार इंफीरियर वॉल एमआई हुआ. एंड ये देखिए आप, इसका ejection fraction 30% था. After 1 year, when we repeated the angiogram, the ejection fraction became 45%. The regeneration of myocardium also, right? You can regenerate the myocardium, because in the dead myocardium also there is a cardiac progenitor cells. the stem cells which are there, even dead myocardium, you can trigger those cells, and you can, by doing meditation, you can open their collaterals in the beginning, and the blood flow starts, and when you're able to regenerate those cells, and then the myocardium, new myocardium regeneration starts, and then thereby you can improve the ejection fraction. Like stem cell therapy, right? We can do it sort of naturally. There's a 80% block here, and see this, there's a 20% ejection fraction. The heart has enlarged, and there's a damage here, right? And ejection fraction is only 20. After 1 year, when we repeated the angiogram, it became 50%, right? The total myocardial regeneration has taken place. So we can regenerate the myocardium by its meditative lifestyle. There's a 100% block here. You can see this. This is Mr. B.R. Panchal. After 1 year, we repeat the angiogram, and you can see this. The whole right coronary artery is opened up, right? Control group. You can see this. This is a patient, Charles Serio from Mumbai. He had these blocks. I've indicated these blocks, but they're small blocks. But after 1 year, following the diet and exercise program, the blocks have increased, because we have been able to document, because we did the psychological analysis, we did that EEG and everything, and we also had, because psychologists coming from DRDO, DIPR, they interviewed the patients, and when we sort of, these, every block represents a thought pattern, and if we do not change the thought pattern, then the block does not decrease with diet and exercise alone. If you change this thought pattern of the person, then the block decreases. So for every disease, for every block, there's a thought pattern. In the LAD, LMCA, ostial, proximal, mid distal, or D1, D2, D3, or even for the ramus, or LCX, left circumflex artery, or right coronary artery. Wherever the block is, by just looking at the block, you can predict that this person's behavior must be this. And actually it correlates. Now, after 27 years of the study, even after 10 years of the study, now we had enough experience. We have database of now more than 10,000 angiograms, and also the psychological database and the repeat angiograms. Now we can say that this block is because of this type of thought pattern. If you change that thought pattern, then you can change the disease. With the meditation, you can change the thought patterns of a person. And see this, there's a block here in the proximal artery, and it has increased after 1 year. So, and then another angiogram. See this, there's a 100% calcified block in the right coronary artery. You can see here also in this picture, stable picture. And the repeat angiogram after 1 year, the lady Rajni Ben Mulchandani from Ahmedabad, and see this 4th coronary artery has opened up, right? So this is how it happens. You can change the disease, and disease, you can open even calcified blocks if it is done in the right way. Person does it sincere. This is the cardiac events over a period of almost 2.76 years, and says there are a number of events in the myocardial infarction, coronary bypass, coronary plastic, cardiac mortality, and any event for that matter. 9 versus 38. So psychological stresses like type A behavior, anxiety, depression, anger, healthy lifestyle modification, overall feeling of well-being. See the significant change in healthy lifestyle group, that is Rajyoga meditative lifestyle group, and type A behavior, anxiety, depression. On the other hand, control group, there's a very little change. So the difference between two p-value is highly significant in the two groups. And behavioral risk factors like smoking, alcohol, and diet, exercise adherence. Diet adherence was much better in the people who are practicing meditation as compared to people who are practicing control, not practicing meditation. And so the exercise adherence was much better in the patients who are practicing meditation. तो जो हम अगर राजयोग का मेडिटेटिव लाइफस्टाइल को एडहेयर करते हैं, तो उसका हमारा डाइट एडहेरेंस, एक्सरसाइज एडहेरेंस, और इवन डी एडिक्शन, स्मोकिंग एंड अल्कोहल was almost 100%, in the addiction part. And we also did the EEG. See the day 1 EEG. On the day 1 baseline EEG, you can see the beta rhythm. Normally it's beta rhythm. With your open eyes, it is beta rhythm. With the frequency is 13 to 18 hertz. That means in 1 second, this rhythm goes up and down about 13 to 18 times, right, in a second. When we close our eyes, that becomes alpha rhythm. We call it peaceful rhythm. It is about 8 to 12, right? And theta rhythm is, when we start accepting things as they are, that is called as loveful rhythm. It is theta rhythm, right? And delta rhythm is usually present in deep sleep. So that is less than 4, right? But after day 7, on day 7, when repeated their EEG with open eyes, beta rhythm came down, alpha rhythm increased. That means the peaceful rhythm increased. The loveful rhythm, what is love? Accepting people as they are. What is peace? Being in the present, right? Putting a full stop to the past, because 90% of thoughts come from the past. And when we are able to put a full stop to the past, then we are able to connect with the present, that is peace. But thoughts will come down, and theta rhythm also improves, right? Within the period of 7 days. Even delta rhythm also improves. See, this can be practiced better with open eyes because it's a change of consciousness. With a change of consciousness, right? And this is alpha rhythm has been improving. Beta rhythm is coming down. Day 7 itself, there's significant decrease in beta rhythm. Alpha rhythm has increased, and the theta rhythm also improves day 7 itself. And delta rhythm also starts improving. But after a year, there's significant change. That means with open eyes, you are happy and you feel bliss in your life. Right? You're as relaxed as you are sleeping. So that is what happens in delta rhythm also. The significant increase in beta rhythm. So this is with open eyes. And say this, when you can see here. And this is heart rate variability. There's a low frequency rhythm and high frequency rhythm. See, on the day 1, when these people came to us, low frequency rhythm is sympathetic overactivity, sympathetic dominance. When these people came to have that fight and flight response was more, right? And the relaxation response, the parasympathetic activity was much less. But as they were learning that program, the Rajyoga Meditative Lifestyle program, they were into the program. Then day 7, there was a significant decrease in sympathetic activity. There was low frequency power, and high frequency power increased. That means now these patients are, the challenge is there, but now they're able to manage challenge with a relaxed state of mind. And after 1 year, there is a more harmony between sympathetic and parasympathetic activity. And after 2 years, again further harmony. So what it is showing to us is, जब भी हमारे सामने कुछ स्ट्रेस आता है, चैलेंज आता है लाइफ में, and they keep on coming every moment, every day. So we are able to face our challenges in our life with a relaxed state of mind. That is what is needed. And that is how this autonomic nervous system function improves with, or you can say harmony improves in the autonomic nervous system. Practicing Rajyoga, and this is how it happens with high frequency power, low frequency power. We also did that epinephrine, norepinephrine levels. Control group, there's not much of a change, but in the interventional group, say this, within a period of day 7, there's significant decrease in epinephrine levels and norepinephrine levels, and that keeps on further decreasing. तो ये हमें दिखाता है कि कैसे हम 7 दिन में ही अपने लाइफस्टाइल को चेंज कर सकते हैं. ये देखिए आप. Then we also did that beta endorphin levels and serotonin levels. In the control group, there was not much of change, but you can see this serotonin increasing on day 7 itself, and similarly endorphins also increased on the day 7. So you have natural morphine coming inside the blood and serotonin making you more relaxed with practice of this Rajyoga meditation. We also did that cortisol levels, both in plasma and urine. 24 hours, we used to collect the urine and plasma levels, right, in the blood. The blood, we were able to know that accurate point, that one point of time, what is the level of stress, that 8 a.m., 4 p.m. Because what happens when we start in the morning, as we get up from the bed, about half an hour after getting up from the bed, our thoughts, emotions, attitudes, and memories, they are responsible for our cortisol release, and it peaks at 8 a.m. And similarly, in the afternoon, again starts at around 2, whatever team we have, and peaks around 4 p.m. Right? So what we teach them, our patients, that they after getting up, in the morning, early morning, Brahma we do practice Rajyoga meditation. And then after that, because during meditation, we have a bliss. And then we have positivity. We avoid any negative thoughts, emotions, attitude, memories. And we instead we keep on churning the positive thoughts, which we call it godly versions. Those are given to these patients. And then they churn those thoughts, positive thoughts. And then 8 a.m. we take the samples in the urine, in the blood. And then it was seen that 8 a.m. samples, there was significant decrease on day 7 itself, right? About 24% decrease in total levels on day 7. And there even 4 p.m. samples also, there was a 12.5% decrease in the evenings. And it further kept on decreasing as the study progressed. You can see here. So it was like this. And even the main problem with this heart patients, is insulin resistance. You must know these people develop this metabolic syndrome, or you can say metabolic syndrome. And the main problem is resistance. So in our study, what we saw that हमने देखा कि cortisol level तो कम होता ही है, 7वें दिन ही कम हो जाता, significant कम हो जाता है. And we start training them. Control group, there was much not change. We were able to stop. The patient starts developing hypoglycemia. We had patients जिनका इंसुलिन 50 यूनिट रोज चल रहा था, एंड इन स्पाइट ऑफ दैट उनका शुगर लेवल फास्टिंग 300, 350, 400 भी आता था, और खाने के बाद तो 500, 550 भी आता था. The HbA1c used to be 13, 14, in spite of having insulin. And sometimes they should severe hyperglycemia, sometimes they go to hypoglycemia. तो हमारे पास आए लोग, तो हमने उनको उसी डोज पे रखा tablets, and the insulin was kept the same. But day 3, day 4, their sugars were coming down, say 60, 70 in the night, or 80 in the night. So we should decrease the insulin. Fourth day, it will further go down. Third day, even if we take half the dose, it will further go down. And by the day 7, we are off insulin, almost off insulin. And then their own insulin starts functioning. And so even their own insulin requirement was much less. And insulin required, see this, there was about 13% decrease in insulin level. That means our own insulin was enough to take care of diabetes. And even insulin sensitivity has increased. Previously there was insulin resistance, no insulin, and then the automatically the blood pressure will come down because insulin levels have gone down. The dyslipidemia will disappear. Unka jo hai, HDL level will improve, LDL level will go down, triglyceride level will go down, and then the weight also starts coming down because the insulin sensitivity is now there, has improved. So now they will not have episodes of hunger. They will not be sort of having, a binge eating type of thing. And this is how all the parameters of metabolic syndromes are addressed here. So what is the science of this program? Rajyoga Meditative Lifestyle Program, or we call it 3-dimensional Rajyoga Meditative Lifestyle Program for healthy heart, happy mind, and healthy body. Can I continue for 10 more minutes? Yes.
कनो राजीव भाई ले सकते हैं 10 minutes?
Sir, anything?
राजीव भाई 10 मिनट ले सकते हैं ना? Yeah.
कुछ कहा सर?
ये कह रहे हैं कि 10
Can I continue for another 10 minutes?
हाँ जी sir, please, all yours sir. All yours sir.
Thank you sir. So now I'll be discussing the science of Rajyoga Meditative Lifestyle for healthy heart, happy mind, and healthy body. Actually, it can address each and every cell of the body and all the non-communicable diseases, right? So what is the concept? See, a serious patient in the emergency department of a hospital comes to the hospital. Maybe it may be accident. And with all the attempts, patient is now gasping or whatever. But our teams tries to revive the patient. And with all the efforts, suppose we are not able to revive the patient. And then the doctor comes out and tells the relatives that, I'm sorry, we tried our best. He has gone or she has gone. Take the body. And like this person, he was a young person. He died of an accident, and in accident. Now, this person's heart is not functioning. No organ is functioning. Almost all the organs are, every organ is now functionless. Now, patient has to become a body. 1 hour back, patient had come, and now we tell that take the body, right? And suppose this patient had the consent to have the consent or had given a sort of a organ donation. He had filled up a organ donation form. He wanted that my organ can use for anyone. There's another patient in the hospital who has developed cardiomyopathy. His ejection fraction is only 10%. He needs a heart transplant. If we do histocompatibility matching or tissue matching, then this heart can be taken out from this dead body, and within a stipulated time, take out this heart and remove his heart from the body, and transplant this heart from the dead body into this patient, right? And this heart starts functioning. What does that mean? Here, the life force energy was there, that the soul was there, or being was there, and that starts functioning. That this heart starts functioning here. So dead heart had started functioning here. Similarly, we can take out liver, we can take out kidney, or for that matter, any other organ, and we can transplant that organ into this person. Even lungs can be today transplanted, right? Even the intestine, some of the part of the intestine can also be transplanted. Now, lots of studies are being done. Cornea can also be taken out and can be corneal implant can be done. So it means that if the being is there, that is the main thing. Life force is the main thing which makes this body function or any organ function. So that means there's a being aspect and there's a human aspect to every human being. So modern concept of human being is what? You know the health definition of health. Health is a state of complete physical, mental, social, and spiritual well-being, and not just the absence of disease or infirmity. WHO definition of health. But now this definition is not being accepted. It is being criticized a lot. So health is not a state. And what is a human being? Human being is a continuum of spiritual, mental, and physical energy. It's not only physical energy. It's spiritual, mental, and physical energy. What is spiritual energy? Is 7 energies, which we'll discuss later on. And mental energy is thoughts, positive emotions, positive attitudes, and positive memories. And physical energy comes through proper exercise, proper sleep, and proper medication. Right? The spiritual energy is energy of truth, purity, peace, love, true love, happiness, supersensitive joy, and bliss, and 8 powers, which we'll discuss later on. And what is health? Health is a dynamic process of harmony and flow of spiritual, mental, and physical energy. It's a dynamic process. Health is a dynamic process. We can change with even a single negative thought, right? Even a single positive thought can make us feel better. And spiritual health, the energy of peace, true love, happiness, bliss, that also little change in that can spoil our health. And similarly, physical energy, proper diet. If we take improper diet, we do wrong exercise or no exercise, and we don't get proper sleep, or we miss a medication, then our health gets spoiled. And another important thing is only soul and few memory cells in the brain are continuous with life. More than 99.8% cells of the whole human body change within every 3 months to 2 years. It is only less than 0.02% or 0.01% cells which do not change, but each and every cell of the body changes within a period of a month or 3 months, maximum to 2 years. Even our whole bones are changing, our heart is changing. Every cell of the body is changing, right? It changes, right? They've tracked the osteophytes, and they've seen that the whole bone has disappeared after 2 years. The new bone has been formed, right? Similarly, heart muscle, whole heart muscle changes within a period of 2 years. So you can make your heart even new. Depends on your team, what type of team you have. Within 3 months, your whole endothelium of the coronary arteries, the carotid arteries, brain arteries, the cerebral arteries, they changes within a period of 3 months. So if you can have a positive team up to continuously for 3 months, you can change the whole of the endothelium. You hold even the plaque, total plaque can disappear from the coronary arteries or carotid arteries or even the brain arteries, cerebral arteries or cerebellar arteries. You can really do it. And our body is made up of 70,000 to 80,000 billion cells. And each cell, about 100,000 reactions happen in 1 second. You can imagine number of reactions happening in 1 second. And you can also imagine that these 100,000 reactions, the free radicals formed during these reactions, they are also washed out in less than 1 second from the body, from those cells. That body has such a tremendous capacity. When you are, but when you are under pressure of time, pressure of work, pressure of perfection, that is type A behavior. Anxiety, when you have pressure of work, pressure of, that is type A behavior. Actually, you are making about 120,000 reactions, so more free radicals in the cell. And when you have anxiety, then you have worry, then you have about 140,000 reactions coming out. When you have irritation, when you feel irritated inside, that means a suppressed anger. That means that time you are making about 160,000 reactions every second in each cell. And when you're getting angry, it is about 180,000 reactions or so in cells. But then body is not able to get rid of all this extra free radicals, and that is how the cell gets diseased. And then when the cell is full of free radicals or toxins, then the functioning of the cell deteriorates like anything, like the beta cells of Langerhans, which are making insulin. When you are under stress, these beta cells which are making insulin, which is not effective. It is that is what leads to insulin resistance. And that is what same way other cells of the body, thyroid cells, or any for that matter, any cell, or adrenal cells, or for that matter, any cell of the body, the same thing happens, especially the target organ. The cells change, the reactions happen. On the other hand, if you practice meditation, what will happen? Then through meditation, you can enjoy peace. This means less number of thoughts. All negative and wasteful thoughts cut out. And the number of thoughts decrease about 90%. Then you can have reactions have come down to 80,000, or instead of 1 lakh, 80,000. That means every second you are able to get rid of 20,000 extra free radicals from the cells. And when you love means accepting people as they are, that means we are getting rid of 40,000 extra reactions, extra free radicals from the cell. Happiness means contentment. That means about 40,000 reactions every second. And then when you're blissful, that means you go beyond. And Anand means going, become bondage free. The soul becomes bondage free. And then reactions are only 20,000. So that is how we say peace heals, true love heals, happiness heals, and bliss heals. We have been working on these aspects also in our research, and we have been working with other sort of. We are also developing now molecular biology in our system, in our laboratories, and we'll start working on that aspect also. So what is stress? Stress is equal to pressures divided by coping ability. Whenever this ratio becomes more than 1, that means whenever pressures exceed our coping ability or inner strength, then we develop stress. And these internal and external pressures may not be modifiable. Internal pressure is nothing but from the mind or body. That is then we have type A behavior, short-tempered, anxiety, anxious behavior, worrying nature, or angry or depressive nature, sensitive emotional behavior, not able to share our stress with friends, with colleagues, or our spouse. That is my internal pressure, right? My body may be, I'm having diabetes, hypertension, heart disease, or knee joints are not good, back problem is there, or IBS is there. That is my internal pressure. External pressure is in the house. We are not we don't carry along with the spouse or with the children. And then maybe working place, there may be stress. Pollution is a big stress. Traffic is a big stress. These are external factors, right? Political pressure may be there. There may be war in the country. So that is the external pressure. So that may not be immediately modifiable. But what we can do is we can increase our coping ability, and then we can always be stress-free. So no medication or surgery in this universe can improve coping ability or inner strength. Only technique to increase our coping ability or inner strength is yoga or meditation. So what is yoga? Yoga means connection. Meditation means connection. Connection with what? Connection with the truth. What is the truth? दो क्वालिटीज होती हैं सत्य की. सत्य से जुड़ने को ही हम मेडिटेशन कहते हैं, योग कहते हैं. और सत्य की दो क्वालिटीज हैं. ट्रूथ इज एटर्नल. पहला सत्य अविनाशी है, शाश्वत है, सदा है. इट इज बियॉन्ड बर्थ एंड डेथ. जन्म मरण से परे है. एंड देन सेकंड क्वालिटी ऑफ द ट्रूथ इज ट्रूथ इज अनचेंजेबल. इट इज वो अपरिवर्तनशील है. इट ऑलवेज रिमेन्स द सेम. अब आप देख लीजिए, खुद को देख लीजिए. हम अपने आप को देखें, कि बचपन से लेके अभी तक हम किससे कनेक्ट रहे हैं, हम ट्रूथ से कनेक्ट रहे हैं या हम जो रियल नहीं उससे, हमने अपने आप को बॉडी देखा है बचपन से या रोल्स के रूप में देखा है, माता पिता भाई बहन इसी के रूप में देखा है. Is it truth? Body is not a truth. Body keeps on changing, right? And body dies and takes birth. So it is so when we are connected with the unstable things, so we'll go into depth of this. What is the truth of human being? Human being comes from a word humus. Human comes from humus word, Latin word which means soil, and being means life force. Life force means soul. So this body is our life force, is our outer self, and this soul is our inner self. Right? Difference between two is soil and soul. The spellings SOIL, I and you. So whenever we become body conscious or outer self conscious, this I-ness and minus comes in. I-ness means ego and minus means attachment. And they're real culprits of causing all the stress. And I also means illness, right? On the other hand, soul, that is you. You means universal, Vasudev Kutumbakam. And you also means we. We means wellness, right? So if you become body conscious or outer self conscious, we develop illness, and when we become soul conscious or inner self conscious, we develop wellness. Now you can get into the detail of this. Outer self conscious, when we become outer self conscious, the three aspects of outer self conscious is body, role, or material. Role means male, female, means doctor, engineer, mother, father, husband, wife. With different roles we are playing. In one day we are playing at least, each one of us is playing about 7 to 8 roles in a day. So each of this is unstable and leads to insecurity. And this insecurity or fear in turn leads to lust. 5 biases. Lust is also what? Is attraction to the body. So it's attraction to your own body or to someone else's body, right? That is lust. So we try to make our body beautiful. We develop our muscles and we get attracted to someone else. So this body consciousness, attraction to the body, or then it leads to, change in thought speed. It increases our thought speed very fast. And that's why our energy gets this energy of true energy, which we will discuss later on, 7 energies, they decrease in a significant manner. And that leads to laziness and careless behavior. And anger is again because of fear. Anger, the fear leads to डर से ही काम विकार पैदा होता है और डर से ही गुस्सा आता है. Whenever someone interferes my comfort zone, then we get angry, and this leads to cynical behavior, that is finding fault with others, and hostile behavior, revengeful behavior. And when we want greed, also is because of fear. डर से ही गुस्सा लोभ पैदा होता है. I want to have more in a comfort zone, right? Even at the expense of others. That is greed. इससे ही हमारा सस्पिशियस और assuming behavior, शक और अनुमान का behavior पैदा होता है, जिसे हम suspicious behavior भी कहते हैं. अटैचमेंट, मोह से चिंता भय पैदा होता है, इससे हमारे अंदर और ज्यादा फिर मोह पैदा होता है. ईगो से, अहंकार से हमारे अंदर टाइप ए बिहेवियर, मेरा काम सबसे पहले होना चाहिए. तो टाइप ए बिहेवियर मींस प्रेशर ऑफ टाइम, प्रेशर ऑफ वर्क, प्रेशर परफेक्शन, कंपटीशन, कंपैरिजन एंड jealousy, ईर्ष्या द्वेष पैदा होता है. तो these are negative mental tendencies. They are actually, this is what stress is all about. Stress comes from outer self-consciousness, body, role, and material. And when we get stressed, because our inner strength decreases and our pressures increase, and then the internal pressure, external, both increase, and this spoils our mood. When we have wrong mood, we go for wrong food, right? The more than 100 moods have been studied, and they have been able to find out why we get compulsive behavior of getting wrong food, why we go for fast and junk food. There are lots of studies. इसमें देखिए, जैसे आपका एक दो बात मैं आपको बता देता हूँ. जैसे whenever we have bitterness in relationships, when we feel bitter in the mind, we go for sweets. Even if we are maybe diabetic, doctor has advised not to take sweets, but still we'll go for sweets. When we feel dry inside, we go for fried foods. When we feel boring inside, we go for hot and spicy foods. इस तरह से हम wrong food खाते हैं. और ऐसे आदमी को, person whose stress is high, then EEG becomes beta plus and super beta. Our brain rhythm increases. So we are not able to get proper sleep. We go to bed at 10, but we don't get sleep. So we'll sleep at 2 a.m., 12 or 1 a.m. in the night. Our quality of sleep will be very poor. It will be very superficial sleep, right? It's a beta sleep, alpha sleep. Immediately it will be our sleep will be broken. And then we get up late, 8 a.m., 9 p.m., 9 a.m., 10 a.m. These are people go to bed late in that then that when they're not getting sleep, they'll go to YouTube, right? They'll go to mobile, they'll see television. So that is how their sleep pattern is disturbed, the sleep cycle is disturbed. And when they get up late, they cannot go for exercise. They will go to bed late, get up late, and no exercise because they have to go to office also for their business. They have to join at 10 or 9 or whatever time. So they cannot exercise. Then जब वो जाते हैं रात को जिम में जाते हैं already, and they do aerobic exercise. और इनको फिर चाय चाहिए, कॉफी चाहिए, कोल्ड ड्रिंक चाहिए, इनको स्मोक चाहिए, अल्कोहल चाहिए to change their mood. And that is how we develop addictions. That is what leads to a diseased and unhappy life. And the dis plus ease, that is loss of ease, loss of peace inside, first in the mind, then in the body. B means बीमारी means B means fear, मारी means constancy of. हिंदी शब्दकोश में meaning ये है. When there is a constancy of fear in the mind, then we develop disease. That disturbs our hormonal orchestra. Hypothalamus, pituitary, pineal, thyroid, parathyroid, pancreas, and adrenal, and our gonads secretion. That is all these 7 glands of the body go haywires, and that is how this is inharmonious release of hormones, and that leads to a chaotic life, right? On the other hand, if you practice inner self-conscious lifestyle, this person actually is living for this person, like outer self-consciousness is like going near a furnace. Automatically you feel hot, you feel unstable, and this person is living to eat. एक खाने के लिए जी रहा है, तो खाने में खुशी ढूंढते हैं. इसकी बजाय आप सोल कॉन्शियस हो जाओ तो स्टेबल, फुल प्रूफ सिक्योरिटी. आत्मा तो अजर अमर विनाशी है, वो तो मरती नहीं है. तो आत्मा के साथ जैसे पानी की झील के बजाय ठंडी हवा अपने आप आती है, आग की भट्टी को गर्मी अपने आप लगती है. सेम वे जब अपने को आत्मा समझते हैं तो ऑटोमेटिकली हमारे नॉलेज ऑफ दिस, दैट इज अंडरस्टैंडिंग ऑफ द ट्रूथ, दैट आई एम अ बीइंग, son of supreme being. My connection with him, because supreme soul, the God, is ocean of 7 energies, is power of 7 energies. I can connect with him. And Brahma, whatever is happening to me today or has been happening to me previously, it's all because of my actions. Whatever is happening is because of my own actions, right? So once I start understanding that, and now whatever I do today will make my future tomorrow, right? So आज मेरे एक्शन कैसे हैं, आज मेरे कर्म कैसे हैं, उस पर मुझे समझ में आती है. तो I always say it, the knowledge is APCD, Atma, Paramatma, connection, and Drama. Drama is whatever we are doing is truth. Every action is a truth. Whatever I do, good or bad, I have to reap the fruit of that. So that is knowledge, understanding the truth. And when we start understanding that of the truth, we start understanding the truth that I'm a being, and also the other person with whom I'm behaving, he may be my colleague, my wife, my husband, my child, or anyone for that matter, is also a being. By nature, every being is peace. Peace wants peace. Peace wants love. Wants happiness. So when we start knowing this, that leads to purity of mind. That means we start behaving in the true sense with every human being. That is purity. Then if purity comes in, then we are able to put a full stop to the past, and that is what is peace. Our thought speed becomes much less. Almost comes down less than 10%. Previously, we used to think about 30 to 40 thoughts in a minute. Now it comes out about 4, 5, 6, 7, 8 thoughts in a minute. And when we are peaceful, then we start accepting people as they are, because every human being is unique. So we start accepting as they are. That is what is the definition of love. True love. Unconditional, dignified, respectful, acceptance and care for each and every human being on the planet. When you have such a love, then you will not have any blocks in your heart, or for that matter, in any part of the cardiovascular system. No blocks will be there, right? And opposite of this is anger, right? When we start reacting, I want the thing to be done in this way. I want you to behave in this way. That is anger. That is cynicism. That is hostility. So love, that is about true nature. And happiness, when we start accepting people as they are, then we develop contentment, inner satisfaction. And that is what is happiness. That is the union between soul and supreme being, that's from the powerhouse, connection with the supreme soul and supreme soul powerhouse. And bliss, when we become happy, we feel contentment, satisfaction, and then our thought speed decreases. When then the number of desires also come down. Then actually we can feel communion with God. And that is called as bliss. And that is going beyond. And then you develop power of discretion. That is called as wisdom. That is a power to identify the truth. And power of judgment. That is called as divine intellect. And then you can have, then that makes our subconscious mind. So if my heart is truth, then I have my third eye of wisdom becomes clean. Then my intellect starts functioning in the right way. And then my subconscious mind becomes peaceful and blissful, right? And then automatically, once then that subconscious mind decides our conscious mind. So when we start practicing these 7 energies, we work with these 7 energies with the human being, other human beings. Then we develop values in our actions like truthfulness, fearlessness, satyata, nirbhayata, namrata, सहनशीलता, संतुष्टता, एकाग्रता, दृढ़ता and धैर्यता. ऐसे 36 वाले values आ जाते हैं. And such a person feels always stress-free. And this person is already happy, so he's not looking for happiness in the food. So he will go for more fruits, more vegetables, more salads, sprouts, and he will have proper food, which is healthy to the body, a lot of fiber, full of fiber, so that our intestines remain clean, or our receptors in the intestine are functioning properly. So then, and chapatis, sabji, milk, and maybe even curd, and that is what proper food, and we call it Shuddha Sattvic food. सातों गुणों को बढ़ाने वाला food, सतो प्रधान. Sato means 7. Pradhan means full of 7 energies. That is they call it Sato Pradhan soul. Then food is also Shuddha Sattvic food. And proper exercise, that is a meditative exercise. We are connecting with, as a soul, I am walking with this body, right? With 7 energies, full of 7 energies. I nourish each and every cell of the body with the 7 energies. And proper sleep. We go to bed after writing a letter to God. We ventilate our mind and intellect properly, clean our mind of all whatever has happened during the day, and write a letter to God, and then clear it and put it in the stream before going to bed. Then I can get very good quality of sleep. Our subconscious mind becomes very light, and we get very good sleep. And then I don't need tea, I don't need coffee, I don't need a cold drink, I don't need to smoke, I don't need alcohol, because I'm stable, I'm happy. And this is how I have a healthy and happy life. So what is incurable? Incurable means it is in plus curable. It is curable if we go in. So this is the concept, and the concept is self-responsibility. Healthy plus heal plus die. That means there's only one person on the planet who can heal you. That is only you. Doctors can guide you, your relatives can help you, and the God can help you 100 times if you follow his advice. Self-awareness. Healthy means swasth. Swa means inner self, and stha means conscious. That means healthy means soul conscious. And otherwise, shav. Shav means body, dead body, right? And so instead of body conscious, you become soul conscious. And we have to adopt a multidimensional approach. To heal thyself, one needs self-empowerment, and empowerment comes from true knowledge, and true knowledge comes from God. God is truth. Information education. Just a minute. So the knowledge is given in the form of information, education, counseling. So information about the God, about the soul, about the mind, about the body, spiritual, mental, physical energy, and as per biological clock. There is a clock inside. You follow the clock, even for meditation, even for what time our cortisol is releasing, what time we do exercise. After sunrise, we take breakfast in time. Work planning is done. Everything is done as per the clock, right? And go to bed at the right time and get up early in the morning. When you enjoy the flow of spiritual, mental, physical energy, one can enjoy ever healthy, ever happy life. So this is how the soul is a point of energy between hypothalamus and pituitary, and this is the seat of the soul, and the point is invisible to physical eyes. And the 3 faculties of the soul: mind, intellect, and personality traits. Mind is team, thoughts, emotions, attitudes, memories. This is our subtle body also. This is aura, so-called aura. Mind has the same shape as the body. Intellect is our judgment power. And this is just got four aspects: the heart of the soul, the wisdom, the intellect, the divine intellect, and the our subconscious mind, right? And the mind has got these thoughts, emotions, attitudes, and memories. And habits, results are nothing but memories formed by repeated thoughts, speech, and actions, right? And a person is identified with habits. These are seven energies of the soul. We call it KP square, low high blood pressure. Knowledge, churning of truth leads to purity. Purity leads to peace. Peace leads to love. Love leads to happiness. Happiness leads to bliss. Bliss leads to powers. 8 powers. This is spiritual energy. Soul nourishes the body, each cell of the body, through mind, through team. Like energy of peace is given to the body through peaceful thoughts, peaceful emotions, peaceful attitude, peaceful memories. Similarly, love is given peaceful thought, loveful thoughts, loveful emotions, loveful attitude, loveful memories. This is how the energy travels to the body. And each body requires all seven energies, but one energy is only for the heart, it is love, for the lungs, it is peace, for the immune system, it is purity, for the brain, it is central nervous system, it is knowledge, knowledge of the truth, and the happiness is for the digestive system, bliss is for the endocrine system, powers are for the musculoskeletal system, and all the seven energies combine to release toxins from the body. And when you do this practice in the Brahmurat, we call it 4 to 5 is the time where the Brahmurat starts. And then we practice about 30 minutes of bliss in the morning. Then these energies come to the soul. The battery gets charged. And up to 8 a.m., when the cortisol release is going on, we keep a team positive. We listen to worldly versions, which is 100% positive team. Energy comes to the body. And you take proper Shuddha Sattvic diet, Shuddha Sattvic Sair, Shuddha Sattvic Need, proper need with positive thoughts, and proper use of medication. Then the energy collects around the body. This is called as aura, which becomes a shield around your body and which keeps on healing all the time. But even when you're not practicing, even during your sleep, it keeps on healing your body and also protects you from the negative atmosphere. So this is how this harmony and flow of spiritual, mental, and physical energy leads to healthy and happy life. So this is what my definition of Rajyoga meditation is. Rajyoga meditation is the science and art of harmonizing spiritual, mental, and physical energy through connection with the ultimate source of spiritual energy for enjoying ever healthy and ever happy, ever wealthy and ever happy life. So this is how this program is conducted. We invite about 50 to 60 heart patients and you have documented patients. But now we are also started inviting diabetes, hypertensive, dyslipidemia, obese, overweight, obese people also for this fatty liver patients in our program. They come with a spouse. They stay here for 7 days with us. And on the day 1, we conduct all the tests, and day 7 also repeat the test. This is how they're taught. And this is how the diet is given, high fiber, low fat, high fiber diet is given to them. And we all enjoy diet in a group. We have morning walk. And this is how the morning walk is done. Even people without this thing, he also walks. And then we have meditation sessions, group support sessions, with picnic also. Then that's on 6th day, we'll have dance, and we all enjoy. They can dance, but they can dance even half an hour to 1 hour continuously. And by now, we have more than we do primordial prevention for schools and colleges. Dr. Kalam was very much in favor of doing this program for schools and colleges, and we would conduct primary prevention program as well. And we have conducted, these heart patients have gone to the people who benefited, gone to the different parts of the Rajasthan and different parts of the country to make people aware how the heart disease happens or how the NCDs come and can be taken care of by this program. And the secondary and tertiary prevention, now we have more than 10,976 documented heart patients coming in 184 groups and who have participated in these programs, and more than 2,000 repeat angiograms. And now this program has reached almost every country of the world wherever the Brahmakumaris are there. So this is how the take-home message is. Spiritual care, be natural. Whatever we are doing, be inner self-conscious. Whatever you're doing in the home or outside, in the working place, not body or role conscious. Be inner self-conscious, be soul-conscious. And always remind yourself that I'm a pure soul, a peaceful soul. I'm a loveful soul. Never say I'm a short-tempered person. I'm a very sensitive person. Just remind that these are your original qualities. I'm a happy soul. I'm a blissful soul. A powerful soul. And for this, half an hour meditation in the morning from 4 to 4:45 or half an hour, and enjoy a blissful stage. And then mental care, and that is you observe silence up to 8 a.m. That is by listening and channeling jewels of knowledge, 7 to 8 a.m. to harmonize the adrenal surge, right? And for physical care, use eat natural, take more fruits, vegetables, salads. This should consist of about 70% of a diet should be fruits, vegetables, salads, and sprouts. And about 30% should be less than 30% should be grains. No, that is what our concept is. What not only what to be taken, but when to be taken. As per biological clock, breakfast between 8 to 9, lunch between 1 to 2, dinner should be between 6 to 7. Before 7, so the 3 hours, 10 p.m. you go to bed, but before 3 hours you should stop eating, right? Be in the lap of nature after sunrise, after cleaning your bowels, then go for morning walk for 30 to 45 minutes daily, and do not have breakfast without having morning walk. And if you can, that is optional. If you can go before sunset with half an hour stroll, if possible, go to bed at 10, get up at 4, and have proper sleep. And proper is your medication. You can undergo angioplasty bypass. But remember, this is not the treatment. This is only a palliation. This is not the treatment. This is only palliation. We have to address the root cause to get rid of our blockages, or for that matter, hypertension, diabetes, whatever NCD we have, we can reverse it, provided we do it sincerely. Om Shanti. Thank you. Thanks a lot for patient listening. Om Shanti. Thanks a lot for
gentlemen. Sir, will you be able to take questions, sir, if they are willing to?
Sir, actually, I can take 1 or 2 questions if you want, because then I have my next session starting at 6. I have to go to Mount Abu. Yes.
Yes, just 2 minutes, sir. I'll just request if any gentlemen, anybody having any question or doubt, Dr. Gupta is here. Okay. Sir, it gave, I think nobody has any doubt, sir. Sir, only request from. Hello.
Yes.
Ma'am, can you repeat?
भाई जी कई लोगों ने पीपीटी मांगा है, अगर वो शेयर कर सकते हैं।
पीपीटी से अभी रिसर्च अंडर पब्लिकेशन है ये वाली, तो डाटा मैंने ना अभी रिलीज नहीं किया है, मैंने आपको दिखा दिया है, बट ये रिसर्च जो ना अभी डाटा ये पब्लिकेशन में है ना, इसलिए इसका पीपीटी मतलब आई हैव शेयर्ड विद यू द मोस्ट ऑफ थिंग्स, एंड आई कैन आल्सो personally, if you mind, you can take my number and discuss with me if you want, right? The Deepak Bhai can share with you, or Mr. Ghoshal can give you my mobile number or WhatsApp number. We can share, right?
और भाई साहब इसको भी अगर आपका सेशन कल था ना भाई साहब,
क्या कह रहे हैं?
माउंट आबू में कल है ना सेशन का आपका?
नहीं, मेरा सेशन कल माउंट आबू में है ना, कल सेशन है ना, और आज भी अभी शाम को माउंट आबू में एक क्लास में जा रहा हूँ, इंटेंसिव पांडव भवन में एक प्रोग्राम है, इंटेंस मेडिटेशन प्रोग्राम, 6 से 7 है ना।
समझ गए। तो राजीव भाई, आई थिंक किसी का क्वेश्चन नहीं है, आप थैंक्स करके पूरा कर सकते।
सर वन लास्ट क्वेश्चन तो नहीं।
दीपक भाई, इनको मेरा मोबाइल नंबर दे देना, है ना? या
वैसा एक क्वेश्चन कोई भाई पूछ रहे हैं तो वो करके
बताइए।
भाई जी कानून राजीव को दे देंगे, वो पास कर देंगे।
प्लीज।
सर आई जस्ट वांट टू आस्क,
मुझे यही बात करनी है।
Sir, can I raise my question now?
Please.
Okay, sir. Sir, you have I think you have speak about the medication. So, is there a specific timing? I have just heard about the morning session only for about 30 minutes or so. So can we perform the medication at any point of time of the day, whether it's morning, evening, night? And
Yes,
how
yes.
long? Only
Meditation
30
can
minutes
practice
is
any time of the
30
day.
minutes is enough. How frequent in a week? Every day
See,
should we do,
basically,
sir?
meditation is a way of life,
Sir.
change of consciousness, right? I'm a being. Instead of outer self-conscious to inner self-conscious. It is not half an hour meditation or 1 hour meditation. Change
Yeah,
of consciousness throughout the day.
right, sir.
But intense meditation is practiced in the early morning, Brahm Muhurat time, when we got, you must have heard about Brahm Muhurat meditation. When we get up in the morning, early morning, then when we get up from the deep sleep, our frequency, our rhythm is delta rhythm, right? And we are able to immediately connect with the supreme being, right? Because this is zero frequency, right? So we are able to come near that, right? During the day, it becomes a little difficult when your frequency is already 15, 20, 25, right? It becomes a little difficult to interact with the God, right? So that is what happens in the morning. Early morning, people practice in Monday in temples and gurdwaras and masjid. They go everywhere. They get up early in the morning. So that is the concept of we practice in the morning. That is intense meditation, where the early morning pituitary surge happens. If you enjoy bliss, the pituitary secretions are harmonious. 9 hormones coming from the pituitary, that's harmonious. And that is, in turn, they control the thyroid, they control the parathyroid, they control the growth hormone, they control the ACTH is there, right? Adrenal secretions. And the FSH, everything comes out in the morning, right? So if there's harmonious release of these hormones from the pituitary, then automatically your all the factors. So, the whole body, 70 to 80,000 billion cells in the body, they're functioning in a harmonious way. All the 8 organ systems are working in a harmonious way. Thereby, in the next 24 hours, all the diseases of mind and body come down. Whatever is happening in the body or mind becomes much better. Right? That's the importance of it. And then you can do practice meditation anytime. We practice almost every hour, about 10 minutes, 10 seconds of meditation. When I get little time, 10 seconds, 20 seconds, maybe 1 minute. If I get 1 minute, I'll do practice meditation during the day, because that's it. I just focus again and again to achieve my state of peace, right? Right, sir. So actually, sir, Dr. Rajiv, sir. Dr. Rajiv, sir.
Sir, can I, sir?
Yes.
Sir.
Please.
Sir, am I audible, sir?
Yes, you are audible. Yes.
Good evening, everyone, sir. I actually sometimes the patient walks to a clinic like in a ECHS, so he comes with a complaint of like I have a breathlessness, uneasiness, and sometimes he falls. I have a sweating, and meanwhile he also complains of the chest pain, and which related to toward the left arm. Sometimes he feels he confused whether it's related to the heart or it is a just normal GRD condition. So what would be the first sign and symptom we need to rectify in that particular patient, sir? And first, we are just taking the medical history and we are reviewing the old medical history, what medication he is taking off, whether he is a CAD patient or any COPD patient also he having. So, sir, first and foremost thing, so what like precautions we took and what this thing management we will go for. Apart from
See, and for that matter, not these days, every patient coming with chest pain, we should treat as an acute coronary syndrome, right? We do ECG, and we try to sort of if a patient is having risk factors for heart disease, hypertension, diabetes, dyslipidemia, obese, all those factors, is smoker, then we sort of just consider those factors also, and then if we start with any patient coming with chest pain, we can use even at least a tablet of sorbitrate under the tongue, half tablet under the tongue, and ECG. If it's then we get a proper done, and then if this family history of heart disease, and then we at least should observe for 24 hours, right? Treating for GRD also. And if everything goes fine, no ECG changes further, tropa is negative, repeat for tropa is also negative, then patient is free to go.
Yes.
Then we can conduct our stress test, we can conduct our echo or a stress echo, and if required, then we go for coronary angiogram, right? So that is the usual standard way of approaching such patients. And these days, because this can also be there in especially ladies with a lot of anxiety. The ladies have a lot of males also have anxiety. So we can the thing is sort of it's very, very important, right? So but I think we can have the available SOPs available for every disease, and we should follow all those guidelines as per the protocols. But again, these things, the meditation, the three-dimensional healthcare, Rajyoga meditative lifestyle, which includes spiritual, mental, and physical care, it is sort of, we can integrate this into our system of modern healthcare wherever we are, right? It helps them to come out, and reverse the disease itself. Whatever disease NCD he or she may be having, and definitely patient improves. Right, sir?
Sure. Sir. Right, sir. Thank you, sir. Most
Sir,
things
thank-
are- Yes, sir. I'm done. Please.
Okay, sir. I have
Doctor,
to go to
yeah,
Mount Abu,
yes, sir.
sir.
Yes, sir. We all thank you for your time, sir, and you accommodated as far as our time, sir. We are really grateful, sir, and looking forward for more such interactions, sir, with
Sir,
other.
I'm ready, sir. I'm ready whenever you want me. I can be online, or also can come to any part of the country wherever you want me,
Yes, sir.
and
So
interact
nice of you.
or doctors from ECHS can come to our center, our complex. We have a very big complex, where
That is
people can come and stay with us, and we can have training program for 3 days or whatever days they have that they're comfortable with, and we can have a comfortable training program for them also.
that I'll coordinate with Deepak Bhai, sir, and sir, once again, thanks a lot for your time and
Thanks a lot.
accommodating
Thanks a lot.
as-
Thanks
as
to
per our-
everyone for patient listening. Thanks.
Thank you, sir. Thanks a lot.
Thank
Then,
you,
sir.
sir. Thanks a lot. Thanks a lot.
थैंक यू सर, थैंक यू राजीव भाई, सभी को थैंक्स।
Vishal, sir, thank you.
Thank you, Rajiv.
Thanks for handling the situation, sir.